Hi everyone, today I shall discuss about the very important organ of our body, that is the vital organ, which is known as the lung. Now you see there are two pairs of lung and which is situated within the thoracic cage, and also in between the lung you will see there is a space by which you can see the mediastinum, and when you cut the mediastinum you will see the heart. Now this lung is very important organ, and you know any important organ we should keep it within the bony cavity, but it has to perform the respiration. That's why you will see the lung not only it is present within the bony cavity, but there is a space, that is the intercostal space between the elastic arches of the bone, and these two things they produces the expansion of the thoracic cage. So thoracic cage not only gives protection but also it gives help in the movements of the lung. Now there are two pairs of the lung, one is right and the left pair. Now first I shall discuss the right one. You will see in every lung you will see there is a pointed apex. You see my finger is projecting, that is the impression of the first rib. So this is the first rib. So there is the impression of the first rib. Above this portion, this region is known as the apex of the lung. So the apex is not a point, it is an area. Then you will see the lower part, the concave base of the lung, because it accommodates the right lobe of the liver through the diaphragm. That's why it is concave. Next, the sharp anterior border should place anteriorly. This is the right lung, so the anterior border descend downwards and medially up to the sternal angle, and then vertically downwards up to the right costoxiphoid angle. Now this inferior border also very sharp one. Next you will see the medial surface of the lung. In the medial surface of the lung you will see there is an impression, and this is the cardiac impression. It is related with the heart. You will see this is the right lung, so the right sided, that means the sternocostal surface of the heart is relative and produces this type of impression. Next thing, medial surface, there is an impression, and this impression is a triangular non-pleural impression, and this triangular non-pleural impression is known as the hilum of the lung. Through the hilum some structures are going within the lung and some structures come out from the lung. So this is the hilum of the lung. So this is the medial surface, and lateral surface is smooth. You will see it is identified by the groove and the ridges. Ridges represents the intercostal space and groove is the impression of the rib. Now you see the right lung is divided into three lobes. One is upper lobe, middle lobe and the lower lobe. How this lobe is divided? It is divided by two fissures. One is oblique fissure that is present in both lung, but transverse fissure it present only in the right lung. You see this fissure, it starts from above the hilum, then it goes, it cuts the posterior, thick posterior border, then you will see this one, it goes towards the costal surface, and ultimately it cuts the inferior border, and this ends up to the hilum of the lung. So this is, you see, this is how you can trace the oblique fissure of the right lung and also in the left lung, same time. Now another fissure extends between the anterior border and the oblique fissure. This is known as the transverse fissure. This transverse fissure is not complete in every lung. So there may be the shortage of the transverse fissures. So why there is making of such a lobe? Because you will see in respiration the one lobe is moving in front, another lobe is behind, and it increases more intake of the air within the lung. So this fissure actually increases the entry of the air inside the lung. So you will see here in the left lung, you will see similarly there is the apex of the lung. You see this is the impression above the first rib. You will know this is the apex of the lung, and you will see the concave base. Here concavity is less prominent because there is the presence of stomach is related in this region and the left lobe of the liver. Next you will see this is the medial surface. Here the cardiac impression is more prominent. You will see this cardiac impression related to the heart. Why it is more prominent? Because 2/3 of the heart lies on the left of the midline. So this cardiac impression of the left lung is very prominent and related with the left surface and part of the sternocostal surface of the heart. Now above that you will see this red color region. This region is nothing but the ascending aorta, which becomes the arch of the aorta. You will see, and from the arch there is arising of the left subclavian artery and the left common carotid artery. The common carotid goes to the neck and the left subclavian it goes to the hand and forms the axillary artery when it crosses the first rib, then it becomes the axillary artery. So next you will see there is a big groove, and this groove is nothing that this is the impression of the descending thoracic aorta. I will show you the groove, that's why I cannot put these impressive marks. So this is what is the relation of the hilum. Here you will see it is related first that is the pulmonary artery, and then you will see the bronchus, and then is the pulmonary vein. So there is bronchus, artery and the vein. Now come to the mediastinal surface of the right lung. You will see in the right lung, I will show you, this is the hilum, and in the hilum there is arrangement of the structure. In the right side there is upper lobe bronchus, then the pulmonary artery, then the lower lobe bronchus, and then lies the pulmonary vein. So bronchus, artery, bronchus, vein, this is the mnemonics. And here you will see this side of the lung is related to the vein. So this is the venous side, and left lung is related to the artery. So this is the arterial side of the lung. Now right side you will see in the impression, in the lower part there is a thumb-like impression, and this thumb-like impression, blue color impression, this side is related to the inferior vena cava, draining the blood from the whole of the lower extremity and the abdomen. Now we will see from the impression of the heart there is an upward impression. You will see impression, I have made it in the blue color because this lodges the superior vena cava. Now there is an arch-like impression you will see which lies over this hilum, and this arch-like impression is nothing but the appearance of the, you will see the draining of the arch of the azygous vein. and this is the vertical part of the azygous vein, lies in the paravertebral gutter. Next you see in front of this blue color there is another impression, and this impression lodges the esophagus. So this is how you can learn the impression of the heart on the medial surface. Why you should know? Because in case of enlargement of the heart there may be some problem. Not only that, if there is some disease, you will see within the lung, so the capacity of the lung is diminished. You know, this is the lung. Now you will see, if I see in front of your neck, if you feel there is the trachea, or give and stetho over that, you will see the windpipe. Now you will see the trachea, which you can feel in front of your neck, and also heard the sound during your placing the stetho. You will see this is the windpipe, and that windpipe divides into many of branches. About 23rd division of the branches occurs, and ultimately it will forms the respiratory bronchiole. You see this type of tree we will see when placing the dye over the trachea, and the bronchi and the segmental bronchus are located here, different color. So this is the trachea, this is the true bronchi, and the bronchi is divided into lower bronchi, and the lower bronchi divided into small segmental bronchi. So up to 23rd division you will see taking place for conducting the air from outside to this, like a tree, branches of a tree, small tree. Now you will see in this way the air is introduced within our body. That means, and there is exchange of gases, because you will see this is terminated by alveolus, which is like a small balloon. And this alveoli, this very thin membrane, and there is exchange of oxygen, and the food material takes place in case of the lung, which is required for their function. So this is the tracheobronchial tree you will see. Now the portion of the lung aerated by this segmental bronchi is known as the bronchopulmonary segment. This bronchopulmonary segment you will locate it over the lungs. You will see, you will not locate it different color, but those who discovered it, they are done by the different color. So there are 10 bronchopulmonary segment in each lung. What is the use of knowing the bronchopulmonary segment? Because it is a very important landmark, and it will produces the postural drainage. When the patient is debilitating, there is the paralysis, then by doing the postural drainage you can clean the lungs in your home. Next thing, the bronchopulmonary segment, it locates some infection like tuberculosis and the other cancerous thing. All this thing is located in this bronchopulmonary segment. And you should know there should be the reduction of the capacity of the lung if any disease affect the lung tissue, like pneumonia, like asthma, the pleuritis, the pleural effusion. You see here, I will show you, there is the pleural effusion on the right side. Here water is accumulated within the pleural cavity and pushes the lung upside. So here there is the reduction in the capacity of the lung. Particularly in the old age, when there is fibrosis of the joint and also the stiffness of the muscle, so there is no movement of the thoracic wall and patient is dependent on the oxygen therapy. So this is the bronchopulmonary segment, and the portion of the lung which is aerated by the respiratory bronchiole, that is known as the lung unit. Now you should know what is the arterial supply of the lung. The two arteries supply the lung. One is the bronchial artery, that is the bronchial tree, 20% supply, and the pulmonary artery that supplies the 80%. So this finishes the lung in short. Thank you everyone, and you should know how our lung is so important. So everyone should try to do breathing exercise at least once daily, one time with 5 to 10 minutes taking. So you will maintain your lung healthy, and that will make us fit and also increases our immunity.